Catherine, and I'm a volunteer on the Project Baseline team at Verily. Today we'll be sitting down with David Miller, Verily's head of Biostatistics and Epidemiology, to go behind the scenes of Project Baseline's community-based COVID-19 testing program. If you're interested in being tested for COVID-19, you can go to projectbaseline.com to get started. Now, to start us off, David, would you be able to share how Project Baseline actually decided to launch its COVID-19 testing program in the first place?
Really quickly, kind of over the course of about 24 hours, people realized we have this huge problem in the country with the pipeline of testing. And the most valuable possible thing that we can do is just get people tested.
Could you tell us a bit more about what exactly makes testing so critically important?
I don't even know who I'm quoting here, but I've heard somebody say, you can't fight what you can't see. And I think that that's so true with this. And so, we really need to get a handle on where this is. Over the next 6 months, governors and public health officials are going to have to make some very, very careful choices about balancing the economy and balancing how quickly people can go back to work. Hopefully we're in a better place, but we really need to be able to use data to have a sense of how much of a better place are we in. But I hope that the governors who really pay attention to that have some really excellent outcomes that they're able to sort of tout it and say, look, data worked, data helped.
I think that's a great point, and I hope so too. Now, how would you say that Project Baseline's testing program differs from other options that are available to people today?
This is a community testing program, not an in-hospital program. A huge number of the people that were getting tested were in hospital, and that's a very different population than the people that are wandering around, with more moderate cases of this. And so we just don't get a full picture of the disease unless we're doing this community testing and collecting systematic data on risk factors while we're doing it.
That's a great point. Now, before we go, what's one more thing that you hope everybody watching today can take away from this interview?
I think that the biggest thing that I'd like people to really understand is that social distancing isn't so much about protecting you personally. It's about population health and protecting the entire healthcare system. Because when you get sick, it's got this whole downstream effect on everybody. And so this is one of those situations where it's not about the individual, it's about our entire community and protecting everybody around us, not just our families, not just the people that we see in the grocery store, but protecting everybody. And I hope this can be one of these moments where people, do things for the public good and not just simply for themselves.
I think that that's a great note to end on. So thank you, David, for taking the time to chat today. I know that I learned so much through this conversation, and I hope that our viewers will as well.